So we were on this slide number 24. So we did the exam questions about the gastrosplenic ligament, which contains short gastric arteries supplying the greater curvature of stomach, and then gastromental arteries, which is supplying the greater omentum attached to the greater curvature. And the splenorenal ligament contains pancreas, tail, and splenic vessels, which we did earlier. Next slide. So you can see the spleen. This they were talking about that the whole surface is attached with the peritoneal, but except the hilum where the vessels enter and eject. So you can see splenic artery and splenic vein. This is the structure of spleen, which you will read more in the histology. And a little bit overview here with the relations, like we were talking about the stomach, and then we have left kidney, we have left suprarenal gland, and then this is the hilum. So you can see the spleen is facing anteriorly and towards the right side, like it is facing, but it is lying basically left posterior side. This is the cross section of 9th rib, and this is 10th. So, and you can see the tail of pancreas is almost embedded in the hilum. So the ligament which I was talking about, the splenorenal or the linorenal ligament, goes from the hilum to the kidney. So this portion contains the vessels and the tail of the pancreas. So that's why it is important from the surgical point of view. So this picture is, I was talking about that this is the cross section which we take. Either we do the sagittal section, that we see the body from the left or right side, or we see the body from top to down. So this is like from top to bottom, like body is cut into half, and then you are seeing from the top like how the structures look like. So the balloon thing which I was explaining you, these are this kind of, you see, this is the whole balloon and peritoneal balloon, and then every organ is invaginated inside with the connections of two strings like this, okay? And wherever there is a small thickening of these connections, they become ligaments. Like this one is splenorenal ligament, which has the vessels. Then you can see the gastrosplenic ligament. This is the lesser omentum, which connects the stomach and the liver. So these are modifications of the embryological phase of the peritoneal layers. Okay. Next slide. So this is again the same. I was talking about the piploid foramen. So they showed the direction where you just put your finger, and then you can see there's the floor of the lesser sac. So this is the gesture predation. Again, there is, so there's some important thing which comes in the I don't know what they call it here, but then practical examination, where you have to point out the parts of the spleen. So they are very specific about the impressions on the spleen. So when they talk about spleen, they have spleen has some impressions depending upon the organ which is lying over it, right? So this part is known as gastric impression because the stomach lies here, and then this portion, this is colic impression, the left colic flexure which I was talking about yesterday, that puts an impression here because of the pressure. And then this is renal impression because the left kidney lies here, right? So that's why these three impressions can be put as a point to mark them, like which impressions these are. Then it has like diaphragmatic surface, which is facing the diaphragm. Then it has posterior extremity and then anterior extremity. Basically it is like if I show with my hand, the spleen is facing like this, right, in my body. So basically it's facing anteriorly and towards the right side. So anterior extremity and at the back is posterior extremity, right? So yeah, so the impressions and the parts of the spleen are explained here. Okay, next. So they just okay, the vascular supply artery is the splenic artery, which is the branch of celiac trunk. It is a twisted course from origin at the celiac trunk, divides into 5 or more branches that enter the hilum. Lack of anastomosis between branches result in 2 to 3 vascular segments with avascular planes in between. So basically what they're talking about, they don't anastomose with each other. So it means that if one part of the spleen is, suppose the supply to the part of the spleen is disrupted, the other part of the spleen will not be supplied because of the connection. Because what happens in other organs, like there are connections between the supplies, so when one supply is disrupted, the other branches, they supply that part through the branching pattern. But in this case, it's like dead tissue because there is no branching. So basically they're talking about, like, suppose this is spleen, and then one vessel coming, and one vessel coming, and then between two vessels there is a plane, or there is a surface of the spleen which does not have any vessels. It is known as avascular plane. So that's why the arterial supply of the spleen is very important, because even if one branch is affected, then that part of the spleen is affected. So this is an important exam point of view from the spleen. So this is, again, they're showing the branches of different arteries. So vein is splenic vein, formed from several tributaries at the hilum, runs to the right behind body and tail of pancreas. So it's a very important relationship behind the pancreas, and then joins the superior mesenteric vein to form the portal vein. So this we discussed in the pancreas, because we told that behind the neck of the pancreas this union happens, because it's a big system connecting the portal vein and the systemic vein. So very important for the liver cirrhosis and clinical conditions related to portal system. So lymph drains to the pancreatico-splenic nodes make sense, because pancreas and spleen, they are lying nearby each other. So the nodes which will lie here, they will drain the spleen. They're showing the veins. You can see this is the splenic vein coming from here, then superior mesenteric vein. Superior mesenteric vein is where? Okay, so superior mesenteric vein is here, and then you can see that inferior mesenteric vein, surprisingly, it drains into the splenic vein, and then splenic vein joins with the superior mesenteric vein to form the portal vein, right? And then you can see hepatic portal vein going into the liver. So when I was talking about the liver disease, when liver is disrupted, what happens, all the blood which is in the liver for the detoxification and the metabolism, it all come back here, and it accumulates in the back veins, in here, and going all towards the organs which has been bringing the blood here. And then because of the blockage here, it is all accumulating at the back, and then causing ruptured vessels, which is also known as varices. So this connection, there are four connections, important connections, which we will do with respect to the organ. So for example, if we are talking about superior mesenteric, then it goes back, and then it happens to be in the rectal area. The hemorrhoids happen. I think you are familiar with the words like piles or hemorrhoids, people having swollen venous cushions in the rectal area, and then they bleed upon constipation or strain during the defecation. So this kind of thing is evident in this kind of clinical disease, because of the back pressure. Those are very prone to rupture and swelling. So this is one kind of example of the portosystemic disruption because of the liver disease. Next slide. So lymphatic drainage of the spleen. Splenic lymph nodes drain into the celiac trunk, celiac lymph nodes. So basically what you have noticed, I think, so far, that everything is arranged according to the vessels. So if there is a celiac trunk, that is a celiac artery, there is a celiac plexus around it, and then there is celiac nodes around it. So lymphatic system, nervous system, and the vascular system, that is the arterial system, everything is collaborating with each other. So the name is according to that. So you can see this is the celiac, ganglion, and plexus. So ganglia means collection of cell bodies, and plexus means branching of the axons. So this all is lying around the celiac trunk, right? You can see the arrow I'm pointing here. So these nodes, these are small nodes. Like you can see small nodes, pancreatic lymph nodes, splenic lymph nodes, and you can see splenic nodes. So all of them are just draining to each other and then finally draining into the celiac nodes. So this is the pathway. So we are done with this. So I will start with the liver. Okay. So accessory organs: liver, biliary ducts, gallbladder, portal vein. So I'm doing this presentation because it is more connected to the previous one through the portal vein. So many things will be already understandable. So next slide. So you can see as a general explanation, where does the liver lie? You can see it liver lies to the right hypochondrium. So what I was talking about, the abdominal quadrants, basically this abdominal region from here to here, and then this is divided into 9 parts by 2 vertical lines and 2 horizontal lines. So this part is right hypochondrium, epigastrium, left hypochondrium, left lumbar quadrant, then hypogastrium, because below the stomach, and then right lumbar quadrant, and then this is near the ileum of the bone. So this is hypochondrium. Hypochondrium means below the rib cage. So liver lies in the right hypochondrium, and you can see part of it is overlying, the rib cage is overlying the liver, and part of it is exposed. So whenever there is disease of the liver and liver is enlarged, the only way we can palpate that it is enlarged by examination of the abdomen here. So somehow this liver, if it's enlarged, then it becomes more prominent at this area. So it can be felt as hard thing if it's cirrhosis, like the condition in which there is fibrosis due to alcoholism or any other disease. So roughly you have an idea that liver is here, and also you can see the lungs are overlying the liver. So it is pretty much covered and protected, and you can see the stomach, and then so there are a lot of relationships. Now by seeing this picture without reading the text, we can make the relations, right? So the right colic flexure, this is the ascending colon, and this is the transverse colon. Right ascending colon, you can see the right colic flexure becomes the posterior relationship of the liver, right? So liver has 2 lobes, right lobe and the left lobe. So right lobe is a little bit like this, and left lobe is like this. So we can say that right kidney lies behind it is posterior relationship of liver, and also the liver has the relationship with the right colic flexure, and then on the top of the liver you can say the lung has anterior relationship with the liver. So, and then rib cage. So pretty much we're making up the relations from the picture. So it's more easier rather than memorizing the text. So when you make a revision with yourself, it's try to do it through the picture so that it makes more sense and you can visualize better. Next slide. So as we did from the picture, I'm just revising it. It lies mainly in the right upper quadrant of the abdomen, MCQ, where it is protected by the thoracic rib cage and the diaphragm. Now the levels. The normal level lies deep to the ribs 7 to 11, right? So 11, 10, 9, 8, 7. So pretty much here. On the right side and crosses the midline toward the left nipple, right? So you can see this is the left nipple and it is pointing towards the left side. So this is a pretty much anatomical explanation. The liver occupies most of the right hypochondrium and upper epigastrium and extends to the left hypochondrium. So this is explaining something in anatomical terms because we're talking about quadrants. That which I explained earlier, it was like a layman term. But then if you see the quadrants, you know the quadrants, then you can see what I was explaining, that there was 2 vertical lines and 2 horizontal lines. So moves with diaphragmatic movements. Because diaphragm is somewhere here, so as we breathe in, the diaphragm goes down. As we breathe out, the diaphragm goes up. So as we breathe in, the liver goes down. As we breathe out, the liver goes up. So this is a normal movement. So what they said here, down on inhalation and up on exhalation. So it is the largest gland in the body after skin. So another MCQ. So skin is the largest gland in the body, also the largest organ in the body, which causes sweating, which causes sebum to release. So multiple functions of skin. And then after that, the liver has a lot of hormones like glucagon and other hormones. So all nutrients are initially conveyed to the liver by the portal venous system. Like all of the blood come to the portal vein and then it goes to the liver for purification, and then has several metabolic activities. So it has metabolism, it has metabolic enzymes, and it has also detoxifying mechanisms. So liver stores glycogen, that is the storage form of the glucose, sugar, which we can utilize during the starvation and when there's no food. And it also secretes bile. So basically bile production occurs in the liver. Very important question. Usually people think that bile is produced in the gallbladder, but no, bile is stored in the gallbladder. It is rather produced in the liver. Next slide. So the liver is enclosed in a capsule of fibromuscular connective tissue known as Gilson's capsule, MCQ. So it is a thin capsule, you can see, very thin capsule encapsulating the liver. And you can see there are multiple blocks of liver. These are units. These are roughly hexagonal units. So every unit is the hepatic unit, which has a function. So it's more detailed in the histology topic, but then we will go through the slides. So liver produces bile continuously. Between meals, bile accumulates and is stored in the gallbladder. Gallbladder concentrates the bile by absorbing water and salts. So basically the function of the gallbladder is storage and concentrating the bile, not producing the bile. So you should know the steps of the bile processing. So gallbladder secretes bile when food arrives in the duodenum. Function of bile is emulsifying fats. So what is emulsification of fats? Now you see small fat particles like this. So emulsifying means making them in such a way that the water particles are making connections between two fat particles. Like this is one fat, this is one fat. So fat arranges themselves in such a way that the water is on the outside and fat is inside. So in that way fat is absorbed more easily, and then it can be digested more easily because of the good absorption. So this is known as emulsification. So like the hydrophobic, because the intestinal lumen is the hydrophilic environment that has like a water loving environment, so it does not have the hydrophobic environment which fat loves. So what happens that with the fat, it arranges in such a way, bile arranges in such a way that the hydrophobic portion faces inside, facing the fat, and the hydrophilic portion is facing to the intestinal lumen. In that way, many fat particles become in small amount, and then they are pretty much dispersed so that they can be absorbed into the intestinal wall. So this is the function of bile. So liver has surfaces of liver: diaphragmatic surface, which is facing the diaphragm, and visceral surface, which is facing the viscera. So diaphragmatic surface of liver is purple, and visceral surface of liver is interacting with the other viscera. Now, what are the recesses? So basically it is, again, I will come back to the peritoneal foldings. So what happens that when there is a peritoneal folding, because of the multiple viscera coming from here and there and there, so sometimes what happens, like small pockets form. These pockets are prone to collection of fluid in case of infection. So these are named according to the location. Like for example, if there is a recess under diaphragm, so it is known as subphrenic recess, because subphrenic means under the diaphragm, phrenic means diaphragm. So it lies between the diaphragm and liver. So you can see this is the diaphragm, this is the liver. So this is a little bit pocket-like space which can accumulate fluid in case of infection. Then there is hepatorenal recess. You can see between the liver and the right kidney there is a little space. You can see they have made this pocket-like structure. So this is the area where fluid can accumulate. So these are most dependent portion in the peritoneal cavity when the patient is lying in supine position. So I think you're familiar with the word supine. Supine means lying flat like this. So obviously when the person will be lying like this, so these pockets will be facing downwards due to the gravity. So any fluid which will accumulate there, it will be facing downwards. There are some bare areas of the liver. Very important question from the point of view, like when they put points for asking in the dissection, and also in a short answer question they ask about it, what are the bare areas of the liver. So bare areas of the liver means the surface of the liver which is not covered by any peritoneum or any ligament. So it's like that. So this is one area you can see, because you can see there is a ligament, coronary ligament, so it is covering almost this part, right side of the liver. But then there is a gap between the posterior. Coronary ligament has two layers, one is posterior layer and one is anterior layer. So between the two layers there is a small gap which has no covering over the liver. So that is one of the important bare area of the liver. So this picture is taken cross section, like we are seeing the person from the any side, from the left or lateral side. So this is the anterior portion and this is the posterior portion. Going to the next slide. So anterior surface, now we will go surface by surface, okay? So anterior surface of the liver has 4 ligaments: coronary ligament, right and left triangular ligament, and falciform ligament, and round ligament or teres ligament. Important in terms of short answer question and also MCQs, and also for the points during the dissection exam. So what happens that this is basically the coronary ligament is this one, okay? It's passing like almost over the top of the liver. So there are 2 free edges. This one is right triangular ligament and this one is like left triangular ligament. So we are done with the 3 ligaments. And then falciform ligament is this one. As you can see, it is a double layer, And as I mentioned before, in the balloon, when the liver was suspended inside the balloon, so this was basically an embryological phase, 2 layer of peritoneum connecting to the abdominal wall, right? So this 2 layer became the falciform ligament in the developmental phase. So we gave it a name, falciform ligament, connecting the abdominal wall and the liver anteriorly. Round ligament is a teres ligament. It is the inferior border, which is a thickening of the falciform ligament that has the different name, that is round ligament, because it is round. And it also has the obliterated umbilical vein. It is again an embryological importance. This umbilical vein used to be open in the fetus, but it is closed off in the adult phase. But it has that remnant of that umbilical vein. So important in terms of questions like Viva question or MCQ. What does round ligament contain? So you should know the presence of a vessel, whether it's obliterated, whether it's patent. So far we did like splenorenal ligament, gastrosplenic ligament, and then now we are doing the round ligament. So these are like important for the knowledge purpose, that what used to be here. Now liver is an intraperitoneal organ, except the bare area of the liver. So this is the right lobe of the liver, and you can see it's pretty much bare, right? No peritoneum is there. So that's how, if anybody asks like liver is intraperitoneal, retroperitoneal, or like what kind of category we can put it into. So it's an intraperitoneal organ, but except at the bare area of the liver. So going to the next slide. So this is a bigger picture. So you can see these are the double layers. So you can see the triangular ligament right and left side. So a picture makes it more easier, and you can see the hanging gallbladder behind the liver. Okay, so there are multiple ligaments. We did the coronary ligament, we did the falciform ligament. This is the bare area between the two edges of the coronary ligament, and then you can see this is the left triangular, this is the right triangular. Then there is another bare area below the right triangular ligament. Then there are multiple lobes, like caudate lobe, which is nearby the inferior vena cava, because inferior vena cava is behind the liver. So this is, we are watching the liver from the top. So another bare area with it below the right triangular ligament. Okay, so now anterior layer of the coronary ligament is formed by the falciform ligament. So this is the falciform ligament, right? It's coming here, and then this is the left triangular, this is the right triangular, and this is posterior coronary ligament. Basically, coronary ligament has been named at different location because of its attachment. Like if it is anteriorly placed, then it is called anterior coronary. It is posterior, and then if it goes to the right, we call it right triangular. If it goes to the left, we could call it left triangular. And then anterior layer, this layer is basically formed by the falciform ligament. So this has its origin from here. So basically it is all what? It's like peritoneal layers, which was embryologically like it was wrapping the organ. So one thing gave origin to the other one. So you can see this is the bare area. This is all covered with the peritoneal layer. But then, okay, so as we can see the picture, we can make another deduction that the area from where the bile duct of the cystic duct, basically of the gallbladder, and then veins and vessels here. So this area is also bare. So there's no peritoneum here. So third area with it. One was below the right triangular ligament, this one. One was between the anterior and posterior coronary ligament, this one, and then the impression where the right kidney lies, that is the suprarenal gland lies. So this impression is also bare because there is no peritoneum, because we know that kidneys are retroperitoneal organs. Also, the location of the inferior vena cava, where it is embedded in the liver. This is also not covered with the peritoneum. So pretty much we did like 3 to 4 bare areas. 1, 2, 3, 4, 5. Yes, 5 with it. And then you can see this is the renal impression. So basically right kidney is lying like this. So suprarenal gland falls here, and right kidney lies here. So gallbladder has neck, body, and fundus. This is colic impression, which I was talking about, right colic flexure. And then this is known as porta hepatis. Porta hepatis means, porta means portal vein, and hepatis means liver. So this is because the ejection and the entry of the vessels. So that's why this area is known as porta hepatis. And then esophageal impression, because esophagus lie here, and then because esophagus lie here, and then it becomes stomach. So the stomach impression lies here. So there are multiple impressions you can see, as in the spleen, gastric impression. So these impressions sometimes come as a pointing questions, like to ask like which impression is for what organ. So visceral surface of the liver. So fissures of the liver. So what is a fissure? Fissure is basically the area where there is a little bit depression, and something lies inside that like two surfaces, like one surface here, one surface here. In between the two surfaces there is a little bit depth. In that depth, whether the ligament lies or whether anything lies, so that is known as fissure in the anatomical term. So we have different fissures of the liver. So we have H-shaped fissure. You can see the picture, H, A, this is the vertical, this is the vertical, and this is the horizontal. So it becomes a H. So how does it form? This is a very important question in the Viva. Like, how does the H fissure form in the liver, and with which parts of the liver? So round ligament, this is the round ligament, so it forms one limb. Fissure of the ligamentum venosum, which had the ductus venosus. It was also present in the embryological phase, but then it was obliterated later. This also forms a ligament in the adult phase. So these two structures form the L arm of the H. So you can see this is the ligamentum venosum, and this is the round ligament. So we made one limb. So fossa for the gallbladder, this is the depression in the liver for the location of the gallbladder. So this is known as fossa for the gallbladder. It becomes the another limb. Fissure for IVC, inferior vena cava, you can see this is the groove where the inferior vena cava lies. So this forms the another one. These two structures form the right arm of the H. And porta hepatis, containing the portal triad, enters here. So this has the entry of the hepatic artery, bile duct, and portal vein, right? So this is the central portion of the fissure. So this picture is very important. Sometimes it comes as a short answer question for drawing this area. So basically this is the liver. We are watching from the posterior side of the body, and also a little bit inferior, so that we can see the this portion from the down. So what is a portal triad? Portal triad means it has three structures: portal vein, hepatic artery, and bile ducts. So these three structures are very important because these three structures are found almost in small unit of liver throughout, because a small unit is like hexagonal unit histologically. So every unit has a small branch of these three structures, and then they finally become the bigger structures and then becoming like this. Okay, next slide. So they just, what I just explained, like you see, small structures here. So these are small hepatic vein, hepatic artery, and then bile duct. So this is the portal triad. You can see the common hepatic duct, which is the major duct accumulating all the bile from the liver. And then you can see this hepatic portal vein, then bile duct you can see. And then, oh, okay, so there's a new ligament that is hepatoduodenal ligament. So this is greater omentum, greater curvature. This is lesser omentum. This is lesser omentum connecting the liver and the stomach. So there is two parts. One part is attaching the liver and the lesser curvature of the stomach, and one part is attaching to the duodenum. So lesser omentum is made by two parts. Sometimes, like we can consider it as a part because it is almost connected. So this part becomes a ligament-like. We call it hepatoduodenal ligament. And this portion of the lesser sac is specialized because it has these vessels enclosed in it. Again, a surgical point of view question. So basically the portal triad is enclosed in this gastroduodenal ligament. So you see, whenever we are naming the ligament, we are naming according to the location. So this is hepatoduodenal ligament. This is hepatogastric ligament. So the epiploid foramen, which I was talking about, usually what happens in the cadavers, the structures are like this, and then we put our finger in this direction. So behind this is the floor of the lesser sac, because lesser sac lies behind the lesser omentum. Next slide. So this is the reputation. We did this picture before. So there are small lobes also, like caudate lobe and then quadrate lobe. Basically, this is quadrate lobe because it is shaped like a quadratic like, and this shape, this is caudate because it's like a tail-like structure, or so these kind of like small lobes are named, but basically there's a right lobe and the left lobe. So okay, so these are some segments of the liver. Those were lobes, and this is like segments. This is important to go through and then understand it, but not so much important for the exam purpose. Like part of it is, but not the whole of it. So I will just go through the thing, like how did they do it. So basically they divided the liver into two parts, left part of the liver and right part of the liver. And then they divided like right medial division. Medial means close to the midline, and then left medial division. And then they divided into this the left lateral division and then right lateral division. So after doing this, what they did, they made the name like this. 2, 3 is the left lateral, then 4 is the left medial, and then right medial has 5 and 8, and right lateral has 6, 7. So basically it's coming like this, and then like this. So it's forming like this. So if you can visualize the formation of the segments, so basically they named it for the blood supply or the surgical purpose. And one is behind the liver, so one you can't see from the anterior side. So yes, next slide. So vascular supply. So liver, it's very important because of the portosystemic shunts. So liver receives blood from portal vein, 70%. Very important question from the MCQ perspective, and also from the short answer questions. bringing nutritionally rich blood, all nutrients that were absent in the SI, and brought back to the liver. So I think this is systemic something. So liver is the bigger organ and will do all the metabolic processing of the nutrient. Hepatic artery, oh sorry, this is small intestine. So hepatic artery is 30% supplying the liver. Hepatic veins formed by the union of central veins in the center of the hepatic globule. So I was talking about the basic unit of a liver. So basic unit of the liver is hepatic globule, that is hexagonal in structure histologically. Every hepatic globule has a central vein. So this is formed like this, hexagonal shape, and then at the center of the hexagon there is a central vein. So all the central vein, they all unite together to form the hepatic veins and drain directly to the I can't see the written portion. So you can see this is again the arterial. So we did this in the pancreas section, like celiac trunk giving off splenic artery, then giving off common hepatic artery, and then common hepatic artery is giving off branch gastroduodenal artery, and then gastroduodenal artery becomes superior pancreaticoduodenal artery interior and superior pancreaticoduodenal artery posterior. And common hepatic artery, after giving this, it continues upward and then gives off right gastric artery, and then it goes up, becoming the hepatic artery proper. And then hepatic artery proper gives off three branches. One is cystic artery, and one is right and left branches. So as you can see, the right branch is almost like right branch and the cystic artery, they're giving off simultaneously, and the left branches, it's the separate one. So just to summarize, cystic artery, right and left hepatic artery are the branches of the hepatic artery proper, and hepatic artery proper is the continuation of the common hepatic artery after giving off gastroduodenal artery. So I'm just focusing on this because we're doing the liver. So lymphatic drainage. So superficial lymphatics in the subperitoneal fibrous capsule of the liver. That is Gleason's capsule. So superficially this drains here, and the deep lymphatics in the connective tissue which accompany the ramifications of the portal triad and the hepatic veins. So ramifications means branches. So branches of the portal triad and the hepatic veins, they have the drainage system for the deep lymphatics. And both of these lymphatics, they go to the hepatic nodes, then it goes to the celiac nodes, and then celiac nodes drain to the bigger, it's like a bigger system of the lymphatics known as cisterna chyli, and then this bigger system goes for draining to the thoracic duct. So this is more discussed in the lymphatic system, but then main thing you should know about the hepatic nodes and the celiac nodes, and then these are terminologies which are used for the lymphatic drainage. So you can see from posterior aspects of the diaphragmatic and the visceral surface, they go to the phrenic nodes. Makes sense because diaphragm is lying on the posterior side of the liver. So phrenic goes to the posterior mediastinal node. So what is mediastinum? So basically, thoracic cavity is divided into three mediastinum. Mediastinum is the thoracic cavity. It's divided into three mediastinum. Anterior mediastinum in front of the heart, middle mediastinum which includes the heart, and then posterior mediastinum which is behind the heart, and two lateral pleural cavities where the lungs lie. So posterior mediastinal nodes lying in the posterior abdominal wall. So that also makes sense because it is receiving the lymphatics from the phrenic. And then from the posterior surface of the left lobe of the liver, left gastric lymph nodes, because the left lobe is lying near the lesser curvature of the stomach. So it also makes sense. So from along the falciform ligament, parasternal lymph nodes. Why? Because the Falciform ligament, this is the liver. Falciform ligament is attaching with the this is anterior abdominal wall. So anterior abdominal wall, when is it attaching, so sternum is here. So sternum has parasternal lymph nodes. So it makes sense that falciform ligament will drain into the parasternal lymph nodes. Now these are very minor details, but then it makes sense according to the diagram. Along the round ligament of the liver nodes of the anterior abdominal wall, so these drain into the in these nodes. So this is the bigger picture. They're just showing different presence of nodes along the arteries. So you can see the hepatic veins entering intravena cava and the bare area of the liver. You can see the caval opening because it is crossing through the liver. And then this is the little like small sling-like opening in the diaphragm. It is also known as esophageal hiatus. Hiatus means opening in anatomy. So esophagus passes through this and then becomes its stomach. So this hiatus is important because if this is loosened clinically, esophagus, people can have gastroesophageal reflux disease, either because of the loosening of this or because of the failure of the sphincter of the esophagus, which controls the food reflux. So this can be problematic in the GERD or gastroesophageal reflux disease. Also, the portosystemic shunts, which I was talking about, one example I gave you through the superior mesenteric vein, where the rectal veins they become swollen and then it presents as a symptom for the liver disease. Another kind of portosystemic connection happens in the last part of the esophagus here. So some branches of the systemic veins and some branches of the portal vein, they have anastomosis here. So what happens if there is a liver disease, so the back pressure of the blood causes swelling of the vessels here, and then they rupture in the esophagus here. So what happens, there is a varices, and varices they rupture, and then the bleeding comes as a projectile vomiting, like vomiting blood, hematemesis we call it. Hemat means blood and emesis means vomiting. So it's a typical sign of the liver disease. Going to the next slide. So nerve supply is from the hepatic nerve plexus. Contains both sympathetic and parasympathetic nerves. These accompany branches of hepatic artery and portal vein. So sympathetic fibers come from celiac plexus, which is formed from the greater splanchnic nerve, which we did in the pancreas, and the parasympathetic nerves from anterior posterior vagal trunks formed from the vagus nerve. So always remember, as a big in a big picture, that vagus nerve mostly supplies the gastrointestinal system. So parasympathetic, automatically you should know, like almost in every gastro abdominal organ, it is vagus nerve. And sympathetic fibers depending upon the region. If you're talking around the stomach, then it is celiac plexus. If you're talking about superior mesenteric area, then it is the superior mesenteric plexus. If you go a little bit down, then it is inferior mesenteric plexus. And so, and as we went through the formation of the splanchnic nerves, you saw that there was a greater splanchnic nerve going down, lesser splanchnic nerve, then least splanchnic nerve, then lumbar trunks. So according to the area, you can make up the blood nerve supply. Imagine the nerve supply that, okay, this makes sense because this is according to the location. So this is an easier aspect to know about the supply. Next slide. So this is so basically vagus nerve, that is the cranial nerve 10, it makes two trunks, bigger trunks. One comes anterior and one comes posterior in relation to the esophagus. So that's why they're known as anterior vagal trunk and posterior vagal trunk. And then you can see there's a celiac ganglion and plexus. You can see sympathetic trunk. This is again a connection of the sympathetic nerves and forming a long trunks across the vertebral column. So imagine there's a vertebral column here, and then one trunk passes to the right side and one passes to the left side. And then you can see down we go, superior mesenteric ganglion and plexus. So hepatic plexus is a smaller one which is around the hepatic artery. So if you know for organ blood supply, then automatically you can name the venous drainage and then nerve supply, because all names match each other almost. So we did this yesterday, just a repetition. One is the greater splanchnic nerve, so that is formed by 4 T6, T7, T8 and T9, and then T10 and T11 makes this lesser splanchnic nerve, then T12 makes the least splanchnic nerve, and L1 and L2 makes the lumbar splanchnic nerves. So these are the sympathetic nerves which supplies different kind of ganglions and plexuses. Next slide. So we will start here, biliary ducts and the gallbladder. So biliary ducts are the ducts which are inside the liver. They continuously produce bile. Biliary ducts convey bile. Basically the duct portion is bile cells produce the bile, and the ducts, they convey the bile from the liver to the gallbladder for concentration. Gallbladder stores and concentrates it. Very important function to remember from the examination point of view, because students get confused whether the liver produces it or gallbladder produces it. So gallbladder releases bile intermittently in response to fat in the duodenum and emulsifies it. The functional unit is a hepatic lobule. It has a central vein, sinusoids and hepatocytes radiating from the vein towards the interlobular portal triad. So basically what happens, I will go through this picture. You can see this is the central vein. They cut a portion of the like imagine this is the hexagonal structure, and they cut a portion, only this one, like a pizza slice. This is the central vein. So you can see dilated venous spaces, like venous structures. Those are known as sinusoids. So these sinusoids, they drain into the central vein. Basically they are radiating from the vein, okay? So blood travels down towards the central vein. All blood is accumulated here, okay? And bile travels up towards the biliary duct. So all the bile produced from the hepatocytes, so you can see hepatocytes produce bile and detoxify blood. And then you can see the space around the sinusoids. These are known as perisinusoidal space of Dicey. And then blood flowing in sinusoids from hepatic artery and portal vein. And these are bile canaliculus. Canaliculus means small channels which are passing the bile. So in a major picture, blood is coming this way and bile is going this way, okay? Next slide. So biliary duct hepatocytes secrete bile into the canaliculi, and the canaliculi drain into the smaller interlobular biliary ducts. These are named after ducts because interlobular means between two lobules, and then these drain into further large collecting bile ducts because they're collecting, and then which merges to form the hepatic ducts. Now right and left hepatic duct, right is coming from right lobe and left one is coming from the left lobe. They connect each other, and then they this is the formation of bile duct. So basically hepatic duct, two hepatic ducts join to form the common hepatic duct, and then common hepatic duct joining the cystic duct of the gallbladder, and then they form the bile duct. So bile duct goes down, and then we did in the pancreas section that it joins with the pancreatic duct and making the hepatopancreatic ampulla, and then it drains into the small intestine. So we just did it, right and left hepatic ducts, common hepatic duct, joining this. So you should know this formation because the names get confused, but always remember the name of the duct relation to the organ. So what is the blood supply to the bile duct? Cystic artery supplying the proximal part of the duct. It is very understandable because proximal part means the origin part, because cystic artery is just near there, right? So proximal part will be supplying this. Right hepatic artery supplying the middle part of the duct, because right hepatic artery is somewhere here. And then posterior superior pancreaticoduodenal artery, which was the branch of gastroduodenal artery, and the gastroduodenal artery itself, this supplies the retroduodenal part of the duct. Because the duct comes here, it originates here, then it becomes the middle part, and then it goes behind the duodenum, right? So retroduodenal part. So this blood supply is very important. They ask question in the viva, they ask question in the short answer question. Like you have to know the bile duct, its parts, superior part, middle part, and retroduodenal part. So, and venous drainage from the proximal part of the bile duct, and the hepatic ducts usually enter the liver directly. So this is important from the exam point of view. So just a bigger picture: gallbladder, cystic duct, and then common hepatic duct. So there is a very important surgical clinical point of view here. So there is a triangle that is known as cystohepatic triangle. It is formed by the ducts and the arteries, and it is a triangle. This is like for the location of these structures during surgery of the gallbladder in gallstones. So how does it happen? It is formed by the cystic duct. It's like a triangle shape. You can see the floor base is formed by the this is a hepatic artery, and then the other limb is formed by the common hepatic duct, as I can see. So this is known as calotte triangle or cystohepatic triangle. Next slide. So lymphatic drainage from the bile duct passes to the cystic lymph nodes because it is associated with the gallbladder, and the lymph node of the omental foramen, that is the epiploic foramen, and the hepatic lymph nodes. So even if you mix up one or two nodes here and there, it does not matter because most of the nodes are interconnected. Some drainage is occurring here, some drainage is occurring here, so you have to know the major lymph nodes which are draining the organ. Next slide. So gallbladder lies in fossa at junction of right and left lobe of liver. Parts, it has fundus, body, and neck. So located at the tip of the ninth costal cartilage. Very important anatomical point because here the pain of the gallbladder in the case of gallstones is located. Body is also in contact with the transverse colon in the first part of duodenum because this is the area of the colon. So obviously it has a relationship with the body. Neck has S-shaped bend. This is S-shaped bend to join the cystic duct, right? Next slide. So you can see this is the fundus, body, neck. This is the cystic duct, this is the common hepatic duct, this is the triangle which is formed. So roughly this is the picture. This is the real-time picture. So there are variations in cystic duct, and why it is important, because from the surgical point of view when a person is undergoing cholecystectomy in the gallstones, so there are multiple shapes and different kind of variations. Just you should see them and then you should know that yes, there are variations from the clinical point of view. Again, you can see this is the Calott's triangle, which I was talking about. So basically it is formed by the cystic duct, common hepatic duct, and the cystic artery a little bit, and then yeah, basically cystic artery, not the right hepatic artery as I was telling before. So this is the correction. So 75.5% has this variation, so you should know this one. 0.5% has this variety, and 24% has this variety. So not focusing on these much, but have to know that like, okay, these things are existing, but then mostly concerned about this one. Okay, so I'll stop here and then we'll continue in the next lesson.